Hi, Brandon Hepner here from Rock Run Physical Therapy. We get a lot of questions in the clinic about plantar fasciitis, so I just put this video together of the top 10 most common questions that we get about plantar fasciitis. So we'll jump right into it and go down them one by one. So the first one is, what are the causes of plantar fasciitis? The most common causes of plantar fasciitis include calf tightness, wearing shoes with poor arch support, being overweight or obese and putting too much stress on that tissue. Jobs that involve being on your feet a lot and standing can be a major factor. And then it's most common in people ages 40 to 70. Number two, what can you do for plantar fasciitis? The first most important thing when symptoms start is to give your foot a rest. So if you're a runner or maybe you're on your feet a lot, do your best to get off your feet and give that tissue a chance to heal and rest. You want to make sure that you're using some ice, especially on the bottom part of the heel, right where that plantar fasciitis originates from. Then you want to do some toe and calf stretches, and I'll show you some of those in just a second. Then you may need to think about getting a new pair of shoes with a better arch support. Number three, how do you prevent plantar fasciitis? You want to make sure you're wearing shoes with a good arch support. Do some stretches for your calf, stay at a healthy weight, and never walk barefoot. This is a big one, walking barefoot. I know there's a lot of people, including myself at our house, we take our shoes off as soon as we get in the house. And if you've got a lot of hardwood, tile, laminate flooring, you just don't have that support on your foot, and every time you take a step, you're pounding down right on the heel where that plantar fasciitis originates from. So I tell people, if you like to take your shoes off in the house because you don't want to get your floors dirty, get yourself a new pair of shoes that are for inside the house only, and then you'll have that good arch support even inside the home. Number four, how long does it take to heal from plantar fasciitis? Typically we see our patients for 2 to 3 weeks and they're getting better. Sometimes it can take as long as 6 weeks, as this is the normal amount of time it takes for soft tissues to heal. Number five, what part of the foot does plantar fasciitis affect? Pain usually starts at the bottom of the heel towards the inside of the arch of your foot. But in worst cases and in really bad cases, that pain can go all the way down the arch of the foot and sometimes into the ball of the foot, because that's where the plantar fasciitis attaches in at the toes. Number six, why does my plantar fasciitis hurt in the morning? At night, the calf muscles and toe muscles, including the plantar fascia, tend to tighten up because of the relaxed position that we get into when we fall asleep. Those tissues get on a slack. Then when you take those first few steps out of bed in the morning, you do a rapid overstretch of those tissues, and when they're inflamed and irritated, you tend to feel that, and you sometimes cause some micro tears in that tissue, and then it starts to inflame, and you get that process that keeps repeating itself every night and every morning. Number seven, how can I treat plantar fasciitis at home? A good thing to do is to get yourself a golf ball or a racquetball or a tennis ball and just kind of massage the bottom of your foot. You want to go all the way from the heel bone where the plantar fascia originates from, and go all the way along the arch and into the toes and work that whole area. Then it's a good idea to use some ice packs, especially early on, to decrease that swelling. And then you definitely want to do some stretches. So what exercises can you do for plantar fasciitis? I've got a few videos and demos here. The first one is you want to make sure you're doing some toe stretches. So right here you can see this person just pulling back on the toes, and what the video doesn't do a good job of showing is you want to make sure you get the calf involved as well. So you're pulling back, holding the toes back, and pulling the foot back as well to get the calf involved. The next one, we want to do some calf stretches, and I've got 3 different options here on a calf stretch. Let's go over them. So the first one is just kind of a standing runner stretch that is pretty common. Want to make sure that the foot and knee are pointing straight forward. Don't rotate them in and out, and then keeping the knee straight and the heel down, just kind of leaning into that, and you're going to hold for 12 to 15 seconds. Try not to bounce too much like this person's doing, and you should feel a good stretch kind of right through here in the calf. And that's the first option. Next option is option number 2. So this is kind of the same stretch, except instead of leaning against a wall, you're just going to lean against a chair. So again, heel is down, foot and toes are straight ahead. And then the third one, not my favorite option here. You can do this on the edge of a stair and just drop your heels down. Sometimes it's hard to control the intensity of this stretch. So make sure you have something to hold on to as you drop those heels down. With any stretch, you want to hold for 10 to 15 seconds and make sure it's a comfortable stretch. Don't make it super painful. So number 9, how does physical therapy help with plantar fasciitis? We do a lot of manual hands-on physical therapy that mobilizes the tissue. One of the best things that we've found, and actually studies show that it's really good too, the outcomes are amazing, is we use a mobilization technique called A-stim. You can look that up on our website. We have some information there, or just go ahead and Google it. But basically, it's using some tools to mobilize that tissue and break up the fibrosis that's going on in that plantar fasciita that's preventing the healing. A-stim did some really good studies, had over 2,000 patients, and showed that with plantar fasciitis, those patients in 8 visits, 93% of them were better and back to doing their functional activity that they wanted to do. Then we want to make sure we get you on a good stretching and strengthening program. Sometimes there's some weaknesses going on in the leg, even sometimes in the opposite leg, that's causing some of that tightness or some of that changes in gait pattern or walking pattern that's causing the problem. And then we use laser for about the past year. We've bought a class 4 laser, and we're getting some amazing results with that. So the last question that we get, can laser therapy help plantar fasciitis? And the answer is yes. Like I said, we're getting amazing results with it. It uses the non-invasive power of light to penetrate deep into the tissue, and it relieves inflammation and pain and gets you through that first phase of recovery, and it facilitates the healing. There's more information on our website about laser therapy. So that's our video for today, and I thank you for watching. As always, if you have any questions about this video, about plantar fasciitis or anything else that's going on, feel free to email me. I read my emails and answer every single one of them. So thank you.